To read back the six subject areas that we identified prior to the break, and then continue with the discussion from there.
Number 1, contracts for focus arrangement contracts. All focus arrangement contracts have to be within the Compliance 360 system. Number 2, completion of all requisite fields within Compliance 360 that are required under our compliance program. Number 3, annual timely submission of the report under a CIA with improvement respected under annual certification, so timely filing of the report and reporting improvement year to year in our compliance. Number 3, positive feedback from monitor relative to district compliance with corporate integrity agreement. Number 4, payments to vendors. A, no payment will be made without the contract being within the Compliance 360 system. B, payment will be consistent within terms of Compliance 360. C, no payment without contract, you repeated, she said for 1, but it was no payment without contract being in 360.
Yes, let's clarify that item 4. Under payments to vendors, item A would be no payment to a vendor without a contract, and B, that the payment that's made would be consistent with the terms of the contract.
Yes. And then remove C because it was repeated, correct?
Thank you.
Okay. Number 5, effective training from the compliance department, and that's all I have for that one. Can you?
Yeah, it would be effective training and education of Broward Health personnel in accordance with the terms of the corporate integrity agreement.
Okay.
And I think, Commissioner, I thought you said under that to survey if the people feel that they're getting effective training?
That was a potential method to measure that, correct. But that's something for discussion, not necessarily a proposal I was making. But yeah, that's certainly on the table. And 6?
Compliance with Broward Health policies and procedures.
I guess the first question would be to the commissioners whether there's additional subject areas that are not within one of those categories that perhaps should be added to the list or as a subcategory.
I don't have an issue, I have a question for Beverly. Now that her counsel's on, I'm going to direct my question to her instead. This is a $150,000 bonus. You are, if in fact it comes to pass, this is just 4.1, right?
Okay.
20% of $750,000. I have 2 questions. One is, as the CEO, are the measures we are talking about, and as a former board member, would these be sufficient to you? Do you believe that these are enough to merit a $150,000 bonus? And if not, what would you add? And if so, fine. And second, if you were going to get a 50% bonus, we did a 30 plus the 20, whatever, how would you, as we go through this conversation, I'd like you to chime in with your ideas of what you think would merit in the 50% scenario a $375,000 bonus. You have a fiduciary responsibility to the board, to the organization, you hire and fire people, you bring people on, you set their salaries. I would like your input through this process. Maybe not immediately, but it's through this process as to what is really worthy of those numbers.
Okay, thank you for asking. There's a lot of questions in there, so let me see if I can
compound it even more, but I'll
So, first of all, I agree with the 6 points. I think that it's very important that you just had read back. Probably contracts is our number 1 challenge. I also think the contracts, we should probably also add letters of agreement into those as well. I think, and again, for an overall compliance, as you all mentioned, this past year we have seen great improvement from where we were a year ago. So we do have to take that into consideration because we have improved. And do we have a ways to go? Of course we do. We are not perfect. We are humans. There's 8,000 employees and 1,800 physicians, and so there is a ways to go, and we are not perfect. So I think I would, for the compliance, I would agree. I think they are great 6 points. Nick would also have to, because he's part of it, as is legal and my team. We're all part of this. Although the buck does stop with me, it totally does, and I get it.
Would you add any to the 6?
So, other than adding letters of agreement to the contracts, maybe I would add that to it as well. Just if we're going to be fully transparent, then let's put it all in 360. I'd like to, before
What would the-
signing,
I'm sorry for interrupting. Now, what would be an example of a letter of agreement that would not be considered technically to be a contract?
that's probably a legal question. Lynn, what do you, for letters of agreement, what do we have out there?
I'm not sure what you mean by,
Finance
I'm not
manager.
sure what you mean by letters of agreement, letters of intent under the employment, which we do put through the process now.
No, but we do have some legal, I think, that have letters of agreement, right? Do you have, or no, am I using the wrong term?
Thinking about retainer agreements?
Yes, something, I know
Engagement
that,
letters,
I know that I'm,
Letters, yep, those are in 360.
okay, I know that I'm using.
All of my, I'm not sure if on the malpractice side, if they're in there. I don't know, Alan does, I don't know if they're in 360, I know mine are, but
Finance managers, like my finance, like for pension investment.
can you, I'm sorry, I can't hear.
Finance managers, finance, managers that we do for pension investment are in there. You know,
Are those focus arrangements?
No.
No.
Well, the key to that, on any of the ones that don't go, that aren't the normal kind of contracts, is that at least that, and Nick and I have talked, at least that they register as a vendor in our system, and we do a focus arrangement and cover person review before we enter into those type of arrangements. I think that's a measure that we would obviously want to measure.
And to that point, sometimes I don't know what I don't know, right? So if everything gets put in there, then I can be held responsible for everything, because I honestly, there are things that come up that, you know, we just said that they may have a contract in a drawer. I don't know any of this until it comes for time of payment. Then I know. And we, as Alan Sullivan said, that we identify, we reteach, you know, we discipline as needed, and we move on.
Are we gonna get to the point where all contracts go through compliance 360, not just focus agreements?
Yes.
Okay,
That's
so,
our goal.
How would somebody get paid under a letter agreement, whatever if it's not, if you don't know what the contract is, it's
I
not
think
in
what
compliance,
Bev
who
was,
else?
I think what Bev was referring to is because anybody that enters into like what I just did with all, you know, the 9 finance managers that we went through, it wasn't just the normal process that you would expect. Like just signing this, get an
I'm
attorney.
not picking on you.
No, it's fine. Do the side letters and then enter into it. We've taken on an additional step of let's say, security, I guess, is I ran them through, I mean, register as a vendor, I made compliance through a focus arrangement and a covered persons review, and then we assigned it and uploaded it into compliance 360. And I think that's what you're talking about, is that anybody that is going to be a vendor of ours needs to register, and go through the system. And I think that's sort of what you're.
And I just wanna make, cause you asked, I wanna make sure, right, cause we don't know what we don't know. So if everything's in there, then I can oversee it with my team, for sure.
At
Other
what
than
point
that,
do they go in?
I'm sorry?
At what point do either the contracts or the letters go into compliance 360?
So the way that it's supposed to happen is before you initiate a service of any, let's just take anything. You would obviously register as a vendor, you know, we would obviously have some executive yes or no sign off on it. Then it will go through the contracting process, or a letter of engagement type process. You know, we don't really have a letter of engagement type of, they're just letters of engagement at that time, and we just sign them and then we move on. What I think you want is to make sure that everybody,
That we do business.
everybody that you do business with gets a focus arrangement and a covered person, because that's the biggest risk that we would have as an organization to the corporate integrity agreement, is if we make payment to somebody that's not in a focus arrangement. From a corporate integrity agreement perspective, not from a, you know, we're making payments without contracts. That's, I want to clarify that. And I think that's what you're alluding to, is that everything goes through the process and compliance and everybody reviews it.
That's not the case now.
I don't know. I'm just, when you asked me, I'm saying that my kind of a wish list, I said I would hope that that's what's going on, but again, I don't know what I don't know.
So I
Isn't it
think
a
the,
requirement, though? It's a requirement of the CIA for every contract to go through a process, right? I thought we volunteered that as part of the CIA, that every contract will go through the process of determining. So the first step would be, it's gonna be determined whether it be a focused agreement or not. So that has to be presented and entered, right? Am I mistaken?
Is there, I mean, is there
Every
any
contract is-
area at all that's not occurring? Because I can't imagine there is.
A $10,000 agreement, is that, would
Yes.
that go in?
Yeah.
$1 million, everything goes in, right?
I think there was some, guitar player that or would be a PO that wouldn't have a contract per se or an agreement.
Unfortunately, they do, because it took them 3 months to get. So
Okay,
even that one's in
so
there.
there's no one-time POs anymore?
We haven't
For
done
the
one.
band, the caterer, so everything.
Not like that band went through 360.
Okay. Other than that, I can't think of anything.
So let me, let's clarify section 1 then, relative to contracts. I think we should make that contracts generally. And 1A would be all focus contracts within 360. And then 1B would be all non-focus contracts in 360. Because to me, those are two separate items, two separate priorities. Obviously, the focus arrangement being the more important one. So
Basically, any contractual agreement between Broward Health or North Broward Hospital District and any party, vendor, agency, firm, whatever you want to
Guitar
call it.
player,
Huh?
guitar player.
Well, individual.
So that's interesting. So the guitar player was a good example because it actually had a contract that went through. I think we do need some clarification. I need to ask George. I haven't seen any, but maybe we do have one-time POs for something that's $1,000 or something that's not a contract, like a engagement letter
Yeah.
or something like
I
that.
think we do, and the only reason I say that,
Be a contract.
no, it is a contract, but I do think that there might be some one-time POs because I think that's in part of the,
The code.
and not the code, but remember in the procurement code, Alan, that we're working on, we're trying to come up with a policy for when is it a one-time payment? To Gino's point, like maybe it's $1,000 or $500 that you don't have a full-blown contract, but you have a PO, and then a mechanism to make sure that it truly is a one-time. So I think that, because I think we're talking about putting a policy as part of the procurement code to handle those.
So why don't we say, so essentially that would encompass, I mean, we're not talking about rules for the system now, we're talking about measurements of the CEO's incentive plan. So for purposes of this, discussion, I think we wanna have contracts that are required to be contracts, that are entered in 360. If there's an item that, for which someone is being paid, that does not require a contract, then that's not a contract within the scope of something that has to go into 360, upon which the CEO is gonna be measured. We'll find a way to define that, but I think we're all in agreement that if there's, a one-time vendor or a certain de minimis amount that does not require the execution of a contract, then clearly there's not gonna be a contract that can be input into this compliance 360.
Let me just run through, I've got 5 topics, I think you had 6 or 7. I think we really need to narrow down the topics from things that are requirements versus things that are measurable.
Well, you had asked me.
No, I agree with you, I agree with what you're saying. So here's the 5, and I think it's all focus arrangements and or contracts that are required to be in 360 and 360. We don't have to have, we're not gonna hold her responsible if Coral Springs decides to have a happy hour and they bring in a piano player for $300. I mean, let's be honest, the CEO's not concerned with that. The CEO's concerned with a contract for employment, contract for vendors. So all focus arrangements compliance must be in 360. I think we can hold the CEO responsible because it's her team for completing the transition from Meditrack to compliance 360 of all the documents, whatever it takes. It's a huge job. I know you're working on it, but I think we can hold you responsible for that as an organization because it's a requirement for us to do that. So we're talking about year 1. Now, next year we may have a different set of objectives. The third is the timely submission of the CIA report with improvements related to exemptions and certifications. We probably are going to have exemptions in the future that may be long, way beyond your ability to control because they're things that may have happened before any of us were involved. But we can look at exceptions year to year and see if there's an improvement, clearly, okay? And we have to sign off on that. So that's a measurable thing that we're being held against, so I think we can ask an effective training and education program for all PH personnel, and that's across the board. Have you effectively managed the organization to train and implement the policy procedures that are required, and we can look at that. We can look at training manuals, we can look at rosters, how many people have gone through the training programs. I think when Nick was making a presentation to us, he had said something about that each manager has a list of things that they're responsible to their department, and they have a compliance program. They'll look at that. We can look at it on a gross level and say, have we effectively trained our employees? I think we can manage that, look at that. And the last thing, is Broward Health compliant with all its policies and procedures? I mean, those are 5 big bullet point things that we can hold a CEO responsible for. I have a hard time holding you responsible for something that happens within an individual department where they may or may not have had a purchase order. It's well beyond, we shouldn't be paying you to do that. But we should be paying you to make sure that every single focus arrangement, that's part of the CIA focus, is in compliance 360. And if it's not, it's your responsibility to find where the problems are within your staff and fix it. I think that's a fair way to look at this. We don't want to micromanage you, but we should macro-manage you. And I think these are 5. I think looking at payments and saying all payments have to be in compliance with 360, that's a policy. That's not a measurable. You shouldn't make any payment unless the contract's in compliance 360. So it's assumed that if it's in 360, a payment can be made. We shouldn't say, okay, all payment. That's not a measurable goal.
That's how we track, that's how we're able to track it.
Correct, that's how you, so we should probably know on a quarterly or annual basis, how many payments were presented related to focus arrangements or contracts that needed to be, that they weren't there. So if it's 3 this year and it's 2 next year, we're making improvement. I think that's a measurable number. We can look at it from a macro level. So that's 5 areas. I think there's others, and I'd like to get a feel from you, Bev, and I had said this, and I think along with Commissioner Barry, maybe we should hear from you. What do you think that you could focus on that would improve the overall quality of the organization? And maybe you should have some input in some of these metrics, and that's what I'm asking you.
Well, right, and that's what Commissioner Barry had asked me as well, and I said that I did agree with the point. I think you hit on them all. I would need some time to look at what you all consider as effective, and work with the team. I'll be happy to come back, and once they're all printed out, I'm more of a visual. I need to see it written out. If there's anything more that I'd like to add to it, I'll certainly bring it back and share it with you. No issues with that. But again, I'm agreeing with the points. The year 1, when you said, I don't know when year 1 starts because I'm already 6 months into the contract. So is it year 1 from today? Is it year 1 from, I don't know when you said, Commissioner Wellens.
Well, when you signed your contract, it went back to January 31st. So I think and you've been in control of the organization as the CEO.
So you're saying January 31st, you want me responsible for the metrics that we're deciding today?
Well, that was my point, that we needed to do this quicker than later. I mean, at what point, what of these items that I just mentioned, let's assume these were the 5, were not known before January 31st? None of them. They were expected. They were all expectations of this.
Again,
Well, is there anyone arguing that there hasn't been effective improvement in?
I don't know. I'm saying if we're gonna evaluate on things, we should evaluate things or no.
I understand, but I think that.
Well, then, if that's the point, then there's no reason to have this discussion and just let it go till January 31st, 2019 and start over.
But the point is to Mr. Patso's point, is when is the period of time that these metrics are going to cover?
Okay, the period of
That's the
time
point.
should be what's in her contract, and focus arrangements were known before she signed her contract and after she contracted, that every single focus arrangement was supposed to be in compliance with 360. I think we can look at the aggregate at the end of the year and say, have we complied? How many did we find this year that weren't in there that we should have found? We'll know at the end of the year. How many items have not been transitioned from Meditrack, which we've been working on? I mean, we can measure that performance. We just look at it and say, here's where we were when we started. Here's where we are. Have we had improvement? It's not going to be perfect. I don't think asking to have an effective training and education of every Broward Health personnel would be unreasonable to look back to January 31st because, Nick, you've had it, right? You have a list.
I just don't know.
You have trainings.
I mean, we have. You're
Okay.
absolutely correct.
So we can measure that over the course of the year where you've been the
But I
CEO.
want to say it's at 70%, at I don't know, just wanna say effective, okay. that's
No, no, I
fine.
mean, we can come up with we can qualitatively look at it and say, where do we have it? Did we get 90% of our personnel trained and met the objective and achieved all their training? That's a reasonable number to look at it.
Well, let's be fair. Tier 2 employees last month or May board meeting, we voted to allow them to get a relatively sizable bonus based on this whole year's performance.
Last year's?
Yeah, last year's. So with only a month left in the year, 2 months left in the year is when this board decided. So I don't have a problem going back. I understand what Bev's saying though. Where are we now and what difference does it make? What is the difference, not what difference does it make, but what is the difference between where we want to be and where we are? These are all requirements. All we are trying to do is measure a compliance with the CIA that has been known to us and known to you, Bev, right? Since you've been involved in the board, even as a board member. So I don't have a problem with it. I get it. At the same time, we just offered, and we're being asked again to give bonuses retroactively for performance a year ago. If we're gonna give bonuses for that, it just would seem fair that we would do the same thing here.
And I think that was a question I had earlier, which is the time period within which we're measuring. We have one time period, year to year for the CIA. We have another time period, obviously, which is our budget year. We have another time period, which is the annual renewal or the annual period reflected in the CEO's contract. So we can kind of put all those together and come up with an appropriate time frame. And I guess it would make sense for it to be consistent with retroactive to the start date of the contract, since that's when that was made. At the same time, as we come up with this plan, the first thing is the categories within the plan, subject areas, and then two, the measurements within those. And considering we're starting the plan 6 months later than the start date to which it's retroactive, I think the year one measurements that are implemented reflect that, and then year two, it might be a different set of measurements or standards within the plan, should we decide that's the way we want to proceed. It depends on how we flesh this out.
So,
It's an iterative process. There's step one, step two, step three.
So I have a question about the training, and I believe in training, but the timing is gonna be off because all the training has to be done by a certain time, like, right? Like, when
Not
does?
necessarily, I mean, they need to be, it's annual within our training plan, right? So we try to get that all done within the CIA,
Right,
within the reporting year of the CIA.
okay, so then that time will work.
And then you also have to train the new hires as well, right? So then that's not really that's just based on when they come in.
Well, training
And
doesn't
then
end,
completing training within 30 days of starting Broward Health.
Right.
Depending on what type of employee they are, is what type of training they have to receive.
right, but you don't ever stop training people. I mean, people are constant, there's always new issues.
We have
There's
scheduled-
always- Exactly.
Yeah, we have, we have scheduled training every other week for new hires. Training goes out within HealthStream.
But even
for
employees that have been here for 8 or
And
10
then-
years,
And then, like I
there's
said, Lynn and I have been doing trainings in regards to the kickback statute, Stark Law, different hospitals.
workshops.
Yeah, training, yep.
But Nick,
I mean, and we did FTC training this year. I mean, as we're identifying areas that the system needs training on, we provide that training.
Nick, but if in the aggregate, if we went back and said, of the 10,000 employees we have, let's say 6,000 of them are required to go through enhanced compliance training, okay? That, somebody that works on a support level may or may not be involved in the compliance, but
Yeah.
we can look at the aggregate and say, of those 6,000 that are required to do enhanced training specific to their job, and you said you have that,
Yes.
right?
Yep.
How hard would us to get a report 2 times a year, 3 times a year, and say, where do we stand? Are we 60% there? Did we achieve
I don't think it would be
100%?
that difficult to get a report for that.
So that's a
We
measurable
provide that
goal.
information of where, all the employees that are required to attend annual enhanced compliance training, where we're at with that. Or the new hires that have come in, how many completed the requirement of attending all the extra trainings they were required to. I think, and I don't wanna speak for HR, but I believe, some of them have been with just like their general trainings that they have to attend, they do those as soon as they come in, and HR tracks all of that. But as part of our training plan, we have the enhanced trainings that you're speaking of.
Right, that are
Right.
required by the
Yes,
CIA.
that are required, yes.
So we
And
can
by our
measure,
training plan.
have we improved that? Have we got them done?
Yep.
Has the management of these departments, have they effectively managed the training and that levels up? I think it's important. Training is a criteria in the CIA. We should measure it.
Right, and I can provide.
Right.
Yeah.
Okay.
at whatever frequency the board requests.
It's not an option, they have to do it. Right?
Correct.
And
It's
we
an
have to do it.
obligation of our CIA, it's an obligation of our training plan, which the OIG signed off on.
Right,
Right, and any changes we make to that training plan, the OIG has to approve.
okay.
All right, so as we drill down on this, you know, and I would note that the language of the contract references compliance program in compliance with the CIAs. That should be our continuing focus as we fill out the meat on these things. We have 16 minutes left for today's purposes. The question is, how are we gonna measure, who's gonna measure, how do we get reports, and do we have objective standards for these categories, or is it gonna be a question of, well, no, when we see it, whether it's been effective improvement?
I suggest that, internal audit does all the reports and, because they're independent from everybody, they report directly to you, so I would suggest that audit does all the reports and comes up with something to report to you. Just my suggestion.
Does our internal audit have, I guess that's a question for you, I mean, in terms of these subject matter areas, is it something that?
Should've left when you had a chance, but.
Yeah, I know.
Is it something that an internal audit would be able to undertake, and do you even know what that would
all the
look like?
information and then put it objectively to you guys, but to actually appraise it and opine on whether or not it's measurable, we couldn't do that. It's quite difficult to measure something objectively. We can say whether or not they need it, here's why, and here's what we have based on the data that we have. So it's your determination. You'd have to determine whether or not they met it based on what we report.
What I was referring to is that they could do an audit of the information to ensure and kind of opine exactly what you said. That
Yeah, we
we
do an
certify
audit.
that this information is accurate, you know, we did an audit on it, it's just another layer of kind of protection for you guys to make sure that the stuff that's being reported to you is accurate.
That's, purview, yeah.
Well, I think it's an excellent idea, because again, you do report directly to the board.
Yeah,
you're
we're very
independent.
independent, so we can provide it.
And hopefully today you'll have a couple of outside members,
Yeah.
added to your ranks.
So is this a tool for us to be able to measure? Is that what you're describing?
Well,
It would be
we'll take, what we'll do based on the criteria that you have, and we'll look at them and then provide information of whether or not we think that the objective is met, whatever it's your criteria that you have, and we look at.
So she meets 9 out of 10, does she pass
Well,
or
we
fail?
just report whatever that, meet 9 out of 10, your determination as to what, whether 9 out of 10 met the goal within that time.
Is the letter of the agreement all or nothing, or is it up to 20%?
I think it says up to. So we can assign relative weights to the individual
Like a
metrics.
balanced scorecard for compliance, is what you're saying?
Well, balance scorecard for the CEO, not for compliance.
Well, for the compliance element.
Right, for that,
Correct.
do a balanced scorecard, so for 80% compliant in focus arrangement, I would assume that would be like 70% of the bonus, right?
Well, I don't.
I'm just, I'm not,
Well, I think the
I'm
language-
saying, like, you guys can set from an importance perspective, what you think is important, and then weigh it to what the 20% would be, so if she.
Hold on a second, where do you get the up to 20%?
I just
I
like
think it
to
says a 20% bonus.
It
So
says
let's try and reading it now.
The CAVASA should be eligible to receive a 20% bonus for the effective improvement of the district's compliance plan for each reporting period. I don't think it says up to, I think it's 20%.
So it's either all or nothing.
Right?
It doesn't spell it out, so, I mean, that could be something, I believe, within the purview of this board, once we establish the metrics, to determine a pass or fail grade ahead of time. So you've got to achieve 90% of this, or 70, whatever the number we
Yeah,
decide.
but that is to give the 20.
Correct.
It's not if you pass 90, you get 18, if you pass 70,
Well, I don't
you
think
get
the contract
30.
allows for that.
Okay, that's what I mean, it's all or nothing.
It's- it's-
So the
it's
measures
all
have
or
to be
nothing.
reasonable,
Well, I'm happy.
and the tools have to be reasonable in order to measure the 20.
Correct.
If you say 100% on everything, it's probably a setup to fail.
Right.
But you need a tool that measures it, and then you need a pass-fail.
Right, so once we decide on the actual specifics, we can assign relative weights to
Okay,
them.
so let's try to attack more of those specifics. Beth, did you have anything else you wanted to add?
No, I'm pretty happy with what you're. So Nigel, before you leave, you could provide us an audit of each one one of these categories based
Well, I'd
on?
love to see the category before I
I think category.
I just heard them, again, I need to read them to understand the reality of what goes into. But based on what you're saying so far, I think what happened is that it's doable. We can look at it and measure to see, for example, we've done that with compliance 360.
That's one of the
Has it
categories.
meet the goal that's set by the CIA and to what degree?
I think 3 of 6 are easy to measure
Right. So
numerically.
we can do that.
I mean, we can measure how many focus agreements didn't, or contracts that required me to, were entered,
Right,
not
and the
entered.
other three don't
Right.
involve Nigel.
Complete the transition of Meditrack. You can look at the Meditrack data
Right.
and what percentage is left.
Completed.
Timely submission CR report, there is no, it is either submitted or it wasn't.
Right.
And it was either submitted with exceptions or without exceptions. So there's no quantitative measurement there. Effective training and educated BA personnel, you can audit that.
Determine whether or not it's met.
Compliance with all procedures, it's a qualitative assessment. Either we're in compliance or not, the CIA report's gonna, and that. And the letter from the monitor is gonna be a qualitative assessment. So 2 or 3 of these are quantitative, the rest are qualitative. I think that's a fair, list to start with, and there may be more. I don't know.
I just think we have 11 minutes. We're not gonna get these done in 11 minutes.
Correct.
So this combined with the book that somebody heisted from me, and the outcome, not the balanced scorecard, we are gonna have a lot more progress on as a whole. We're not gonna be done with any of it. And I think we will probably need another workshop to finish all 3 of those, because there's gonna be 3 distinct parts of evaluation. I think what Commissioner Klein has here is a good outline. We have to put some meat on the bones, so that she has tools, so that Bev knows what we're measuring and we know, and that she has an opportunity to review with her counsel whether or not she thinks they're even achievable. She doesn't want to be set up to fail, but she wants to see that they're achievable. So in the next 10 minutes now, what can we do to take these a step further so we can hear the balanced scorecard? Because the balanced scorecard to me is a critical part of the operation of this organization. When you look at it, I may not agree with many of them, how they're measured, but I do agree with what they're trying to measure. So I'd like to get to that as quickly as possible, but I want to get all 3 of these. And are they going to bring me back that book and copies for everybody?
I think they're making copies right now.
Okay, because I think that's important for the board to see as well, so that they can understand what the broad spectrum of evaluation under section 6 and section 7 of the agreement are. So Commissioner Klein, how would you like to proceed with these 5 or 6 under 4.1?
Well, I think the question to me is how we make progress between now and our next meeting in terms of gathering information that may be useful if we're putting the meat on the bones of these criteria. And who might be assigned, to each of those tasks. Relative to contracts, whether they're all in 360 or not, I think we need to know where we are at a given point in time. If we're gonna be, I think it would be important to know where we were on January 31st, where we are on July 31st, for purposes of knowing
There's no.
where we still need to go.
I don't even, I'll
No way to
look,
do it?
I can't, I wouldn't feel comfortable saying that the numbers are right. Nick, you don't think so?
Well, for purposes of the annual report, we're gonna need to know by August 31st,
Well,
correct?
can I make this?
Yes, because we're gonna have to produce a report to the IRO, right? As part of their annual requirements, they have to do a transaction review of all new or renewed focus arrangements. They take a random sample of 50. The methodology for their sampling is we sign off on it and the OIG signs off on it. Right now, we can't produce that report.
So let's
And
piggyback
I
off
couldn't
of
tell them
the-
this is completely accurate if they asked me today to give them a list of all of our focus arrangements.
So, can I make a suggestion? We revamped the process in January, and it got going February 1st, which is kind of really good for this discussion because your contract went live February 1st. So from a measuring perspective, why don't we measure all the contracts that went in from February 1st to, the prior year, or keep going, and anything that's not entered correctly, she gets measured and she gets a 20% bonus. Remember, we talked about it, the the stuff that's not in compliance 360 is gonna flush itself out eventually when payment gets made, and eventually all those will get into compliance 360. So from a measuring perspective, the dates actually line up perfect. February 1st to January 31st in a year for 20%. And that,
Well, that's just one component. You're saying, Alan, you're suggesting that you would measure from the prior year?
no, I'm saying that her contract went live.
Since February 1st, how many contracts went into 360?
Since January, we've done 1,700 contracts since January.
It's a good sample size.
All right, so I think in terms of a data point that we like is how many contracts were entered into compliance 360 since February 1st? It's a piece of information I think would be helpful.
Probably like 1,600.
Whatever the number is, let's get that, and by August 31st, we're gonna know from the compliance department where we are on gaps with contracts remaining, or at least some sense of.
Well, I mean, yeah, I mean, it really does come down to the accuracy of the information that was transferred in.
Right, but you'll let us
Right,
know
I mean,
that.
we're missing a lot of that.
Right, and, again, we're creating something out of whole cloth here, so we're gonna have to feel our way through this, but the more information we have, the better decision we can make. So, I would look to the information from Alan for our next meeting, and from you, Nick, as well, with regard to where we are on inputting these contracts, how many,
Well, I mean, I
how many
think
may remain.
contracts administration would be the appropriate.
Which
department
falls
to
under me.
speak to that.
I have all that information, we're monitoring it, we're developing dashboard. I can get you all that information, that you guys want.
All right, and likewise, the related item is completion of the fields. Well, again, the breakdown would also be focus arrangements and non-focus arrangements. So that's subcategories within number of contracts that went into the system. And then item 2 would be completion of the fields within compliance 360, which I understand you guys are working around the clock on.
Yeah, so
and
if you're
where
gonna
we are on
complete the
that,
fields, what I would suggest, because there's over 300 fields that are in C360, and you would need probably 10,000 auditors to audit every single field for every single contract. So what I would suggest is, and I'm open to this, and have each one of you come and sit with my contracts and look at the process, and you guys determine which fields that you think are important. I can give you obviously what I think is important, but there's really 5 or 6 important fields that we use, right?
I mean, right now, the key fields that we're lacking is the effective date,
term
the
date.
end date, the type of agreement, compensation under the agreement, is it an auto renewal, is there, I mean, there's several key fields. And then that's not to get into the other questions,
So those fields are not
Right.
currently filled out, not there.
or they're not accurate. Like I wouldn't, like, when I was here.
Again, I was a little
number of
confused. I thought we
contracts.
were talking about building out the system rather than.
No, the system is built.
I can give an example.
Completion of these
Wrong.
fields.
It's the transitioning from Meditrack to compliance
All right,
360.
so all the
I would say,
fields
maybe
transition
the
over.
better way to look at it is, give us,
One at a time,
Yeah.
thank you, go ahead.
maybe the better way to do it is, give us an assessment of where you think we are with compliance 360, okay? Where you need to be, and give us a time frame you think will take to get there. Okay, because I think if you say we're here, we're 30% there, in order for us to get to 100%, we think we can do this in 6 months, or a year, or whatever the number is, and then we can come back and sort of figure out how we wanna measure that progress. I think that's a reasonable way to
I
look
think
at
that's
it.
fair. We can do that for sure.
When you say some of the information is inaccurate, do you mean incomplete or actually wrong in compliance 360?
Both.
That's
So the
why,
number of contracts isn't necessarily the only parameter, it's,
so
They're all in there, yeah.
we
no,
inherited,
it's the information that's.
Commissioner
There's
Broward,
two components.
we inherited 85 years of horrible contracts, and then we tried to convert them into a system that was not done well. So you have to also remember that we're also processing 1,700 contracts as we keep going. So if we don't continue to process those contracts, then we're gonna have no contracts, and we're gonna have focus arrangements, and we're making payments. So, we went from 5 to 20 employees, and we brought in some outside help. They weren't capable of doing it. So there's a lot that's going on here, and we've made great progress, and we'll continue to make great progress. But I think that we should start this year with focus arrangements. That's our biggest risk to the corporate integrity agreement. If we can get our focus arrangements with 5 or 6 key fields that you guys have determined, we can show you them all. And the 5 or 6 that you feel key, that legal compliance, we all agree on, you give me that, we'll get it.
Well, give us-
But back to the missing or inaccurate, the only way to identify that is to go contract by contract by contract, and that's what your
Correct.
people are doing now.
Yes.
to either fill in the missing or correct.
And I have people working every day, Saturday and Sundays, like, I'm even thinking about bringing in a second shift of employees just to get the contracting process done. That's how important I take it.
And one of the things we want to avoid here is creating such a burdensome or onerous system that doesn't utilize existing information, so that we're not expending tremendous amount of resources to undertake this evaluation and spend more money than we'd be paying out under a bonus anyway. I mean, so clearly we have to be balanced in terms of what we're gathering. Hopefully it's readily available information. But let's proceed with, I think we've covered that item. We're gonna get information on where we are today, on the compliance 360 angle. Item 2, I think, is a pretty obvious one. I don't know that we need any work there because we're gonna be filing or not filing an annual certification on a timely basis, and we'll know whether there's improvement or not. So that's, I think, a board item. We'll know when we see it. Item 3, we'll have to monitor feedback, which reflects some increased compliance. We'll obviously have to develop a mechanism for obtaining that feedback, consistent with whatever the monitor is comfortable with. But I don't think we need anything further there today, between the next meeting, and that's just, want to create a mechanism for that. Item 4, payments to vendors. To me, that's either the payments were made or they weren't, right? So payments have to be made only if there's a contract. If a payment's made without a contract, it gets flagged, it gets reported as one of our measures. We need to come up with what a measurement is of how many of those mishaps we think are acceptable.
So-
And then 2 is the payments were made in compliance with the terms of those contracts. Again, we'll come up with a standard of how many we think in a system our size might slip through the cracks.
And that's where Nigel would have to get a sample size and prevent,
Right.
we couldn't, it wouldn't be feasible for us to review every single payment. And you guys just tell me how you want to work it for this, but from a payment perspective, if as senior managers, create a check and balance that we stop it, and we have to do a settlement, is that a good or a bad? To me, that's good from a compliance program, but you guys would have to opine and make sure that it's very detailed, so there's no arguments in 7 months when the bonus gets paid out. Was that a good or a bad? And whatever we decide, we'll live with. We just need to make sure that it's clearly defined, which I think that we're doing just some information.
Okay, so we'll think further on that item on.
Well, in a situation like that, in the event that the individual responsible for that issue, they would not, as I recall, at least some of the conversation we were having surrounding the incentive compensation plan, that individual would end up being excluded from the plan because
They got disciplinary action.
Correct, they had some disciplinary action or something.
But wouldn't the payments portion of it, wouldn't that really be captured between all the folks arranged being there and also compliance with all policies and procedures? I mean, as a subset of that, as part of adhering to all of our policies and having all of our contracts on 360, I don't know if it needs, that should be part of having all those contracts there. I don't think it needs to be a separate line that you need to, you're not managing to, well, we paid 10 checks this year, we paid 7 checks next year, no.
I think that probably comes in because of patient care as well.
Correct.
We never want to do anything
Right.
to interfere in patient care, so I think some of our issues, and Nick, you know better than I do that, some of the issues are that it was a patient care issue and it's acting, so.
It is, but I think one of the issues is it got to them,
Yeah,
And it was.
right? That it got to that point, that it became a patient care issue.
But I think if we have a-
Without people in the regions taking action and taking ownership and responsibility sooner,
But-
right? And raising up the issue of like, hey, we're 2 months out, this is a needed service, we still don't have a contract, it's still hung up somewhere. And instead of finding out about it like a day before, right? Of like, oh, we're gonna lose coverage on Saturday if we don't get this signed today.
Right, but couldn't Nigel prepare a report asking an audit to say, how many payments were presented for, over the course of the year, for focus arrangements or contracts that should have been 360 that weren't?
Actually, just talking
you
about.
wouldn't know, I don't know if you would be able to know that, because if it goes, we would have to create a log from AP.
Right.
If it goes to AP, and right now, we're just sending it back to the user and saying that there's no contract to be work with compliance and legal.
So you're not logging that, so you don't know if that gets presented again and they still haven't finished the contract.
Yeah, we don't, that's a great idea, but we don't currently log it, so I wouldn't be able to say,
Okay.
you know, how many events happened.
No, we do log it.
Yeah,
So,
I think, yeah.
I log every exception that comes through this organization, in my respective areas or not.
Let's just,
Just to give you an example of how this can happen, and to Nick's point, yeah, we should know about a lot of this stuff, but part of knowing about that also requires some of the people that we're contracted with to let us know that they're not going to 3 days before they're about to sign a contract, say, oh, well, we're not gonna sign it. So, I'll give you an example. The Compliance 360 report shows that there's an auto renew on a contract. If you don't look at that contract and realize that it's really not an auto renew, it really actually does expire, then, and someone provides call. The good news is, the bad news is that it happened and they covered call. The good news is that we identify it, we don't make payment, and then we have a contract prior to making the payment vis-a-vis a settlement agreement or whatever avenue we take. So sometimes you are gonna have that scenario, but for the most part, yeah, you should be getting better.
but that's what I'm saying, I think this is more just review the log for
Direction,
information
yeah.
purposes as opposed to a metric, because I don't think it's a fair metric.
Yeah.
To really look at, because we shouldn't have a lot of it that for contracts is in compliance with, unless we find that in the log, there's an enormous percentage of them are auto renew contracts that aren't auto renewing. That's a different problem to have.
And also, to that point, the benefit of this log that I'm keeping is we're able to start identifying trends in this now.
Okay, so I think from information purposes, seeing that log in the gross aggregate probably would make sense. What are one-time exceptions, what are patient issues, and what are contracts that were not properly done and we ended up? I think you could probably prevent that if we needed that, right?
And we're required to keep it, that just so you know, that log is my annual exception report.
Yeah, so that's what I'm saying, I don't think that the payment issue is something we necessarily need to measure the CEO. I think we wanna measure the overall performance of contracts in general.
Right, and when I was speaking of tracking remuneration, I was more talking about some of the compliance obligations in regards to tracking remuneration under the CIA. As with Compliance 360 being inaccurate, it's making our job very difficult to do that, right? Because we went out, we contracted with a program to pull all the payments data, and I think I've talked about this in the compliance committees, right? Pull all the payments data to where we get this dashboard, and then it's supposed to feed in, and then 360 is supposed to feed into that. And then we should be able to run real-time reports of are we paying consistent with the terms of the contract, right?
The trend on that is more important.
But with 360 being inaccurate, we can't even do it, right? Because all the information that we would pull out of 360, a lot of it's not correct. So it makes it very difficult to do those automated, where now we gotta go in and, well, okay, we're gonna pick one, or we'll do a sampling and look at, 10 focus arrangements and see as to where, the importance of having our contract database accurately reflect what the contract is we would be able to do that on a much easier ongoing basis and identify when things are reaching a critical point, right? Where if we have a contract max with a focus arrangement for $200,000, and we're 6 months into it, and we've made payments for $190,000, right? What's going on? Why is it so off? Right now, we would, if Compliance 360 was accurate, we would know that information from the fields in 360, and that system would pull that out, and we could match up based on tax ID numbers, right? Because the Compliance 360 is gonna have the vendor's tax ID number, and the payments is gonna have the vendor's tax ID number. But
Right,
that's
so-
what I was saying, more of like tracking remuneration, is the importance of having the contract system accurately reflect.
All right, so I think for today's purposes, that information will be on what our current capabilities are and what we can measure versus what we anticipate being able to measure in future years. As the program gets put together, we'll know, all right, this year it's X, for next year it's Y. So if you can bring back, and Gino as well, and Alan, what we can measure today in terms of compliance with those payment obligations, where we're making payments we shouldn't, or vice versa, and what our capabilities are going to be going forward once Compliance 360 is fully implemented.
When you
We are already over time here, so we do need to wrap up.
Can I just ask one more question, because I'm getting in trouble? When you said all contracts are gonna go into compliance by August 31st. You just meant the contracts themselves, but there will still be inaccuracies.
Well, no, I mean, we really need the information to be accurate by the end
So
of
it's gonna,
August.
so they're gonna be all in there and the information is accurate and complete.
That's what we need by the end of
By
this.
August, focus arrangements, we're working on focus arrangements.
Big
There's too
goal.
many contracts, we're not gonna be able to do that. I wanna get focus arrangements, that's our biggest priority, which I would
So
hope
that's for
that you
focus
guys would agree with me.
arrangements.
If you guys want me to steer it in a different direction, I'll do whatever you guys ask me to do, but my personal opinion is focus arrangements is the best.
But isn't focus arrangement the focus of the monitor? I mean, is it?
Well, I mean, that is, focus arrangements are the focus of the
That has to be the priority, I think.
Right, but I mean, all contracts are important that they're in the system, because, and there's
You may
been a
miss
focus
certain-
arrangement review done.
Right.
Right.
The focus arrangement is what's gonna trigger a Stark law or a kickback law violation if it's incorrect or it's not in there.
Anything can trigger,
A lot of that
anything
stuff.
can trigger a
But the focus arrangements, a lot of those are where we have the biggest problems, correct?
Right, but the inception
With
of
the
the
accuracy
process,
of the information, yeah.
the inception of the process has a review on whether or not it's a focus arrangement. So if you have that process, now again, we're talking about new and renewals, but we're also talking about, as it relates to CIA, all past agreements, which is
Correct.
really the heavy lifting. But
Yeah,
right, as we sit here right now, we have a front-end process. It's either a focus arrangement or it's not, and we conduct that review on the front end. Just because it's not a focus arrangement doesn't mean we're not going to follow the same procedure and enter new or renewal contracts
Right, but
into the system.
But the focus is not a choice, it's a requirement. We have to have them in there.
Yes,
Right?
correct.
So,
Yep.
so the goal is, we're not there now, the goal should be 100% compliance there.
On new contracts.
New and renewals. we
I
are-
understand.
Chairman,
we are-
can, we need to get to the balance scorecard. I would recommend, with everything that needs to be done, I would volunteer Commissioner Wellens and the HR group, I volunteer to actually before our next meeting, call a meeting to go through this and the plastic, this about her performance, what her performance needs to be, and put some more meat on the bones for us before the next meeting so we can finalize this, decide, and get it done. If we wait till the next meeting, it'll take us hours to get through all three of them. We need somebody, either we need a special call meeting, or because this is all technically HR, they should go to the HR committee and let them come back to us with something before the next meeting, instead of waiting to the end of August.
Yeah, I'm happy to have the HR committee make some progress in these areas. I think we need to make some progress, and I think at our next meeting, it'll have to be an agenda item, and probably a lengthy agenda item at that. So why don't we do that? I think that there's enough there to start with, enough direction from the board. I don't think we need a vote. I think the discussion has been a special board workshop. I think we've made a lot of headway today, and if the chairman of the HR committee is amenable to call an HR committee meeting to make further headway on this.
Yeah, sure.
All right, so we have that.
Can I just request that we try to schedule someone we can all be there?
I agree with that.
Deal.
Absolutely. So the members of the committee are Commissioners Yuri, Wellens, and Berry.
Yeah, we would like everybody.
I think this requires all board.
And obviously, you know,
input.
We want everybody there.
Yeah, I think all five of us should be there, but obviously at least all three at minimum. But obviously, let's, and I've asked Patricia to coordinate schedules as much as possible since a lot of us travel. So let's all let,
One of the-
when we're available over the next 4 weeks.
Okay, on that note though, just because we did vote on this many moons ago, the last Wednesday of every month is a regular board meeting, the Wednesday prior is committee day. I have cleared my schedule as best I can with foresight on that matter, and I will tell you, since we voted on that, I think we've complied with it once, okay? And yesterday's a perfect example, okay? And I don't mind, I moved my Thursday to Wednesday, and then we turned around and scheduled
I
an
have
HR
moved
meeting.
to continuous,
You know what I'm
the
saying?
judges in Dade County.
No, I'm not,
every single time.
I have no
They
problem,
deny it.
I just want to be clear,
That's on
it's
the
not to
agenda.
you personally, I have no problem having moved it to Thursday. My point
It's on
though
the
is that we then turn around and schedule stuff on Wednesday.
I think
It's
we,
brutally difficult for anybody, myself included, to function that way, and I think we should be respectful of everyone's input.
Absolutely, and that's an item on today's agenda for the board meeting.
we need a calendar integrity agreement.
Not to be confused with
another.
I will be held in contempt and
All right,
jailed if I'm not court.
All right, with that, I'll take a motion to adjourn the special board workshop.
So moved.
Second.
All in favor? Aye. All right, we stand adjournment.